You're watching Central Valley Today.
Welcome back to Central Valley Today. Our next guest is dedicated to educating the public on what's healthy and what's not healthy. Dr. Adam Rajul usually joins us every Monday to talk health and nutrition, but he's making a special appearance today. Hello, Dr. Adam.
Hi, how are you?
I'm great.
Good.
So I know we're going to be talking about the healthcare system in America. How do you want to start off?
Oh man,
I know where to begin.
How do I start off? I will start off by saying this. Luigi, I wish you came for me to medical advice and you have known not to go to McDonald's. One thing I want to make very clear is violence should never be the answer, right? There's a lot of issues in the medical system, but murder is not heroism. We need to come up with the collaborative method on how to fix this issue. I know both families are, going through burden right now, and I hope for both families that something positive does come out of this, because it is an eye-opener, for everyone.
And so, can you explain to the people how the healthcare system works in America?
I am a hospitalist, so I work primarily in hospitals. It's a different realm for outpatient. But since Babylon times, it's all about money, right? Money is the bottom line. I think we just need to cut down on the corporate greed, and we need to put patients first. They say in sales, the consumer is the person you need to listen to, and I think we need to listen to our patients. I think there needs to be more strict regulations as far as price caps. Especially for drugs, medicines are very expensive. There needs to be health literacy programs for patients so they know, what they're getting into. Mm-hmm. There needs to be more reward for preventative medicine. Practicing preventive medicine so patients don't get sick. There needs to be more money going towards health rather than administrative costs. We just need to keep the patients in mind. And then for those of you watching at home, it's okay to lose faith in the system, but don't lose faith in the people. Don't lose faith in the medical doctors, the nurses, the practitioners, the therapists. We do care. What is important is that we all need to collaborate to come up with better solutions. The physicians, the politicians, the insurance holders, and the patients, they need to be involved in this process as well.
And you've had your own experience within the healthcare system, you had a surgery. Can you
Yeah, I actually had a unique position because I got to see healthcare. I see it as a doctor, but I also got to see it as a patient. And yeah, I'm paying a lot per month. I don't want to talk about it because you guys told me I can't swear on live news. So, but what really was a damper is how much I had to pay out of pocket, and it was an outpatient procedure. So I got to face it as a patient. The system needs improvement, but I think there is positive change already underway as far as having stricter regulations, especially on profit margins, including the drugs themselves, and just actually having more transparency. Like, what are we paying for as far as the deductibles? What are these out-of-pocket costs? Nobody knows. You're signing a 500-page contract with all these clauses, and we don't know what's going on. I didn't even know what some of the things I was being billed for. So. I think there just needs to be a lot more transparency, and we need to put the patients always first.
And how would you say the healthcare, how does that affect patients?
As far as sometimes you want to get them placed in a certain, facility. Sometimes you want certain medicines covered. And a lot of times there's things we want to do as physicians for the patients, but we can't just due to insurance purposes.
Okay, that makes sense. And how can we improve this situation, you think?
Basically everything I talked about is just having, stricter regulations, health literacy programs, giving more reward for preventive medicine, having quality improvement measures. We get a lot of readmissions just due to lack of resources, so providing more resources. So more costs are actually going for the patients and not helipads on yachts.
Okay. And where can we go for more information?
We'll be back next week Well, Friday. We'll be back Friday.
Next
here.
Friday?
Yeah, we'll be back here Friday.
Are we ditching the Mondays then?
Well, we'll see. Maybe we'll see. We'll see. I think Friday will work next week.
Do we have
yeah.
like a sneak preview about the topic, or?
I'm gonna try to get my chef to come. If she doesn't come, then I'll probably just do some push-ups on live TV.
And I'll join you. Okay.
Let's do it. Let's get it.
Thank you so much,
Thank
Dr.
you.
Adam.
Thank you.